A deadly bacterial disease that can cause pneumonia could be in the water at a Ridgeway nursing home, according to some nurses we spoke with there. And DHEC is investigating multiple cases of what's called Legionnaires Disease. Our Ashley Jones is following this developing story. She spoke with an expert about what makes this illness so dangerous.
Well, for starters, we found that this disease will travel through water droplets in the air and can lead to a deadly type of pneumonia or lung infection, which of course can be partially dangerous in a nursing home. An infectious disease doctor tells me how you mitigate the spread can be crucial. Dr. Helmut Albrecht is an infectious disease doctor with Prisma Health. He says this disease poses a greater risk for the elderly than younger folks.
The older, the worse. And patients with a weak immune system.
Also, people who are current or former smokers and people with chronic lung diseases. This disease does not spread from person to person, and while outbreaks can occur, cases are usually isolated. Dr. Albrecht suggests finding the source of the bacteria if multiple people inside a facility test positive for the disease.
These outbreaks in the nursing home or in hospitals where they stopped the entire water flow and didn't even bathe the patient anymore and stuff like that. That actually gives you more Legionella.
As far as how long it takes to get over this disease, Dr. Albrecht says it depends on how severe your symptoms are.
So most people actually never realize that they had this or have a pneumonia that will never be diagnosed because they handle this in the outpatient setting. But if you have a severe disease, you have to get on a ventilator. It can take weeks to months to completely get over this.
He says many people are exposed to this disease daily, and finding it in nursing homes is not uncommon.
Nursing home, you have a large building. You usually have larger cooling towers and larger water systems. And you have a whole lot of susceptible individuals.
Symptoms of Legionnaires' disease are similar to that of COVID and the flu and include coughing, chills, and fever. In some cases, people will experience muscle aches, tiredness, and a loss of appetite. Reporting here in Columbia, I'm Ashley Jones, WIS News 10.
Symptoms of the disease usually occur 2 to 10 days after exposure. Doctors say Legionnaires can be treated with antibiotics.